Thanks. I'm Somen Banarjee. I'm Director of Public Health in Tower Hamlets, so Tower Hamlets Council. So I'm going to bring a sort of council perspective to this discussion, which actually kind of captures quite a lot of things we've already talked about. So just next slide. So just a little bit about Tower Hamlets. So Tower Hamlets has for women, has the lowest healthy life expectancy in the country, and for men it's the fourth lowest. That's the period of time in which people actually consider themselves to be healthy. So there's a significant health challenges in the borough. It was just to highlight the level of health inequality in the borough. So it actually, if you look at things like heart disease, premature deaths from heart disease or cancer, it all follows the deprivation gradient. So actually that's Isle of Dogs. It's the light blue, which is more affluent Canary Wharf bit, and health is much better there on average. But right above it is Poplar, which has some of the most deprived wards in the country. So that's the scale of health inequality, but also highlights the importance of working at the most local level that you can. So, yeah. So I'm just going to talk a little bit about how we frame community development in the public health team in Tower Hamlets. Initially we were in the NHS. In 2013 we moved into the council, which has really changed the way we work. But in about 2008, we reconfigured our team and developed a new role, which is public health locality managers. And the reason for that was because one of my perceptions, actually just starting out in public health, we were very much, in a sense, ivory towers. So we were writing needs assessments and doing pieces of work in which we were looking at the population in abstract. But actually, a lot of the people in the team had never even sort of gone round Tower Hamlets or had an understanding of populations. So the public health locality manager was a way of really connecting us with the community that we were serving. So Brenda is one of the 4 public health locality managers. And Tower Hamlets is kind of divided into 4 localities, so it actually works with a lot of the structures which emerge subsequently. Sorry, can you just go back a bit?
Yeah.
So actually one of the advantages of this approach that we've taken is it's enabled us to capture stuff in quite an organic way. So things have come along, pilots, all sorts of things over that period of time have come. There was Department of Health pilot, which is called the Healthy Borough Programme, which because we had the connections in the community, that's one of the reasons why we got the funding, but also how we could make the best use of it. Things like the Well London programme. I don't know whether people in the room are aware of that, but we had 2 really successful pilots, and we were able to engage with it quite quickly because we had public health people who were actually working in the community. So just in terms of kind of where we're now as a council, and people will be aware that there's a lot of savings in councils, there's restructures. We've shaped the public health team in terms of place and people, really prioritising or reprioritising healthy environments and healthy communities. And one of the key things, I think one of the key opportunities working in the council has been a very different sort of organisational climate to working in the NHS. But I think if you can you have a lot of real levers there that are real opportunities. So one of the things that we've really focused on is working with the Health and Wellbeing Board in Tower Hamlets and actually really getting the political members engaged in the agenda. And so we're just actually about launching this new health and wellbeing strategy, and it's very different to our previous one, and it's less about specific diseases or conditions, but it's more about how the system works. And one of the key priorities at the top is the community's driving change priority, and that is a priority that is actually led by members of the Health and Wellbeing Board, because actually councillors really care about what's going on sort of from a resident's perspective to a greater extent than perhaps some of the council officers who are less connected to what's going on. So that's a sort of key kind of strategic lever for us to really bring in actually some of the things that we've talked about into what we do over the next few years. Oh, sorry, next one.
Next one again.
Yes, next one. So next slide. Can I get those more? Sorry, I'm doing someone else's presentation, that's why that bit is a little bit complicated for me. And just one more. Yeah, so one of the things, we don't have a lot of time, but one of the things that I really wanted to kind of highlight is that, so we're going through a period in which we're making savings, but we're also having to commission things in different ways. So can I just get, I'm not quite sure. Yeah.
Next one, Mark?
Yeah, next one. Oh no, okay, back. No, sorry about this. So essentially, we're in a situation in which kind of, for years and years in Tower Hamlets, we've had, we are a focus for a lot of pilots. The pilots come and go, and you may have something that's really successful, but in a few years' time, it's the impact is kind of dissipated. So one of the key things that I'm trying to do in terms of the public health funding is to get actually sustainable funding into community development so that we're not continually having this cycle of pilots coming and going. And so, but it's quite a challenge, and it's actually a challenge I'd really like to share here, because if you think about, sort of council procurement, people were talking about it today, about the sort of council procurement rules, timetables, performance indicators and all of those sorts of things, that makes actually commissioning around the co-production and community development, it actually gets in the way. So what we're trying to do, and I think we're not the only borough that's trying to do that, is to take, say, the principles of the Well London programme, the principles about starting from the community, identifying where the energy is in the community, supporting and empowering, all of those things. That's what we're trying to do, but we're trying to make it sustainable, recurrent funding. And that is a real challenge. How do you write a specification, or how do you develop a specification around that? And so when the tender has actually just went out last week, but the interesting experience has been working with potential providers who, first of all, were kind of a little bit perplexed by the whole thing in terms of going, well, you're not really going to tell us exactly what we're going to do. No, we're going to work together, but we are going to support you because we have some, there's principles from the Well London programme, there's training and support, there's sort of, one of the things is the participatory research, actually training up people in the community to understand what their needs are. But that's kind of where we are, and it'd be really interesting to know whether other places are have similar challenges. So I'll just pass on to Brenda, who's going to talk about one of our programs.
So I'm Brenda. As Somen said, I'm one of the public health locality managers. I'm just going to go back to what Somen's mentioned before around our work around being a healthy borough and working in localities. So what we want to... Yeah, thanks. Okay.
One more.
Oh, you're going backwards or forwards? Oh,
I think you're going backwards.
Yeah. Sorry. So yes, one of the legacies of the Healthy Borough programme was the CANDOs, and that was our way of really working with our communities on a very local level. Somen mentioned before about we work in localities, and we divided basically the borough into 4 areas with equal populations, really, so that we felt that that was the best way to work. And the Can Do programme was about community development and empowering our communities to decide what they wanted to do, what they wanted to address and how they wanted to do that. So it was very much resident-led. And not only that, it was put into the hands of community organisations to facilitate as well. So we commissioned it, but that was it. We then handed it over to our community organisations, who then had to recruit a community development worker who knew their communities already and were able to go out into their communities and talk to people, find new people that had ideas and wanted to do things within their community but just didn't have the resources in the first place. We were addressing some of our public health outcomes as well. The main thing originally was around obesity. Obviously, because Tower Hamlets, being such a deprived borough, had high levels of both child and adult obesity. So that was the general theme that was running through. And it was about supporting individuals with their ideas, not only just to deliver them, but to sort of think them through and think about the sustainability of their projects. So we were, yes, we would sort of support some short-term projects, but we really wanted people to think about, well, how are we actually going to sustain that within our community? Who could I bring on board? Who's already out there doing things? And wanted to really make an impact on the people that they cared about locally. So the key aims was, as I said, to challenge the obesity that we were facing, and also draw out those activists, those people that were maybe doing small things but wanted to sort of do it on a larger scale, and give them that sort of seed funding as well to actually get going, but at the same time think about how we were going to continue that. And as I say, the borough was divided like that into the 4 locality areas. And grass...
It seems to be skipping along.
Okay. That's okay. Next one?
The next one, yeah.
The principles we worked on was that it was definitely a grassroots thing, and that's what ran through the whole time. And we wanted to make it accessible and easy, so the application process we kept as simple as possible. We didn't want people to be tied down with filling out long forms and having to, really sort of, demonstrate that they were part of a larger organisation or anything like that. We kept it really simple and accessible. The community development worker went out and helped people to sort of formulate their ideas and complete the application forms. We had a couple of themes that this sort of project and ideas had to work around, which was active lives, healthy eating, food growing, that sort of thing, sustainable projects. And they were very much personalised because people knew what other people wanted to do. They talked to their neighbours, they talked to their communities, they talked to other parents, and that's how these ideas and projects were born. And also they had to be sustainable. Not all of them, there were sometimes just one-off projects, which might have been small, but as we said before, had a huge impact on that community. So although we were looking for value for money and sustainability, the project didn't necessarily have to continue running for a very long time. We took care of the monitoring and evaluation. Of course, we didn't need to put that or want to put that burden on the community members, but at the same time we offered a lot of training. So we offered training around writing bids and applications for other projects. I think if you go to the next slide, we also offered lots of training around first aid, food hygiene, so that these projects could get started, but also people could develop their own skills and continue to do what they were doing in the community. So, it's got a mind of its own. So, we started in 2019, and up until then, so up until 2016, we'd actually supported over 428 new projects, which we... Oh, is it? Okay. We invested nearly £200,000 directly into setting up these new projects and engaged over 10,000 people. So if you think about it, that's about £20 a head, really, of investment. But the impact that we had and these projects had was massive compared to the investment that we actually had to put into that. I mean, there's lots of numbers there about the different types of projects. So, 235 new projects which were encouraging physical activity. We also introduced mental well-being in the later stages of it, because obviously we all know that mental health and mental well-being impacts on all aspects of life, and we weren't actually including that within our project themes. So that was introduced quite late, but we already managed to sort of, in the last year, get 15 projects around that theme. And with these themes as well, you found that lots of the project crossed all of these things anyway. They might have been about food growing, but obviously that involves physical activity. So we were sort of, people were almost trying to tick all the boxes and develop projects, that sort of were meeting all the criteria. And we were trying to say, no, you don't need to do that. Just something small that, addresses one of these is absolutely fine. But that was just the nature of the think they had to cover, all the criteria. So in terms of the impacts, I mean, there was two sort of groups of impacts. Obviously what we were looking for around addressing obesity, so people having a better knowledge and understanding about their own well-being and a healthy lifestyle and what that actually meant. Measured changes around health behaviour. I don't know, remember all of this. It's about impacts on attitudes around healthy eating, their families, their friends. A lot of people sort of gained so much knowledge that they didn't have before. And the other part was things that we weren't really looking for but realised was happening at the same time was that connectedness and people sort of increasing their social networks, reducing isolation, developing their own skills and becoming, more confident in being able to lead a group. People that had no idea that they had these skills and were able to do them in the first place, and we just sort of teased out and, through the training and just sitting with them and working through their thoughts and their ideas, just improving their confidence to actually go out there and talk to people and, engage with other people and get them to sort of engage with the projects that they were proposing as well. I've got Wenwoods down there, but that was just the way what we introduced later on in the project in the last year or so to try and have a measurement of outcomes, which was around mental well-being as well. And just in our initial year of measuring mental well-being as an outcome of these projects, we were already starting to see an improvement in people's well-being, mental well-being from engaging in these projects.